Welcome to Healthcare Simplified, a podcast from DeliverHealth. Nothing's inherently simple about healthcare. That's why on Healthcare Simplified, we explore with today's top health leaders how to maximize ROI, staff satisfaction, and public health outcomes by building greater efficiencies into the healthcare connections that matter most between clinicians and technology, providers and patients, and people and their health. I'm your host, Mitch Holdwick. Let's put simplicity to work together. Welcome back to Healthcare Simplified, episode number 2. Thanks so much for tuning in. And please, a reminder to rate, review, and share. That's how we get more listeners to our show. And last time we talked about the language access and the future of language access with our partner Azizi from the Mill and UHealth around health equity, which is a great transition in today's topic. We're going to dive into some of the research from KLAS, who are really starting to quantify and measure all this incredible work being done across the industry, specifically in digital health. And as we know, for our listeners, we're all kind of centered into the quadruple aim of healthcare around reducing costs and improving population health, patient experience, and team well-being and productivity. So it's so important to kind of keep that in mind as we go into today's conversation, and specifically with KLAS. And for those of you not familiar with KLAS, a research company, and the real why behind KLAS is their focus on studying emerging technology. This is a quote from their website. But healthcare organizations are constantly being approached by new companies hoping to present their latest solutions. With so many startups clamoring for their attention, healthcare leaders often feel the need for guidance on which solutions they should consider. KLAS can help cut through the noise. They work with healthcare providers, innovation centers, and others to identify new companies to research, then validate which emerging companies are solving real healthcare problems in innovative ways. So that's kind of the why behind KLAS. And we're going to include links in our show notes to KLAS, also the report we're going to talk about as well. So I encourage you to check that out. And actually, this is a great segue to our guest today. We have Michael.clark, CEO of DeliverHealth. Michael is committed to building organizations that simplify healthcare complexities and put the patient and provider first. As CEO of DeliverHealth, he guides a team of healthcare experts in clearing the way for essential, resilient connections among providers, clinicians, and patients. So Michael, welcome to the show.
Thanks, Mitch.
For those of you not familiar with you, I'd love maybe a little more background on who you are and what you do.
Sure. I'm the CEO. We really stood up the company about 18 months ago now as a spin out from Nuance. Prior to that, I was a GM inside one of the healthcare divisions within Nuance, and just been in healthcare 25 plus years, all on the partner vendor side of the equation, just helping out customers solve problems.
That's awesome. And it's a great segue into today's topic. As I mentioned, we're going to take a look at a report from KLAS that just came out. And depending on when our listeners are hearing this, it was the fall of 2022, around the top 20 emerging solutions in healthcare. And DeliverHealth was the only one that ranked top 10 in all 4 areas of that quadruple aim I mentioned previously. So number 1, actually, in improving patient experience. Number 4, for improving clinician experience. Tied for 6 for improving outcomes, and tied at number 9 for reducing the cost of care, which is a testament to a lot of the things, Michael, you just mentioned in your passion. So let's dive right in. The first question I have for you, having looked at the report, and again, a reminder to our listeners, we'll have a link to the full report in our show notes. But why do you think DeliverHealth, the company you just mentioned, has roots in documentation, EHR services, earned a top ranking in improving patient experience?
You know, I was at the conference and there were some 43 companies that they evaluated. So incredibly proud of the team and the company for KLAS recognizing this. But, I think it really comes down to, why were we number 1 in patient experiences? We bring to the market a mix of software and services. Quite honestly, it's somewhat novel and unique when it comes to digital health. The market's evolving rapidly. Just a ton of point solutions, each with merit in and of itself, but no comprehensive solution out there. And the EHRs cannot build enough to fulfill the evolution of the demand toward the drive toward digital patient engagement. So the market really needs companies like ours. And I think what KLAS recognized and in their research was we actually do that. And what's novel in our approach, and honestly also, is we're very selfless in focusing on solving the current problems, customer problems, and we meet them where they are in their state of readiness. They've made lots of different investments. The technology in many ways is disconnected. And what we try to do is bring solutions through a mix of software and services, ultimately along with the change management on the evolution of these hospitals and health systems towards their digital transformation, so to speak. Our KLAS report that came out in 21, we were distinguished ourselves with our approach like no other, where we received A+ rating in the 4 areas that they looked at. As KLAS would tell you, in the research they've done, no other company has ever come up with across the board A+. That alone was testament to the solution that we have. And what it really, really boils down to, we've demonstrated the superiority that we're seeing in the market because we simplify the complexities for patients and providers, and that solution lives that vision. So the bottom line is our solutions work. They deliver what we said they will, and hospitals and health systems see it. And the only barrier is themselves in how fast they can move toward digitization. So we kind of ride in the car with them and try to help them accelerate.
Going back to earlier comment on the Quadruple Aim and the 4 different areas that DeliverHealth was recognized in, we talked about patient experience. And you talked a little bit about in your intro in terms of bridging the gap between the worlds of digital health and mid-revenue cycle and documentation. How does a company like DeliverHealth that ranked number 1 in patient experience also address those other universal goals as well collectively? And as I mentioned, the only company recognized in the top 10 of those 4 areas. So how does that kind of spill into the other areas as well?
I didn't really realize we were the only one that was in the top 10 in all of them. That's fantastic because people, again, try to pigeonhole different companies in different ways. And it's really hard to pigeonhole us. At the risk of being redundant, we just try to put simple into action. And I think in doing that, it goes across each of those 4 legs of the stool in that quadrant. And we live that mission. It's not simple for the providers and the physicians to do it, but when we put simplicity in, it gets them on that course. And if you break down the 4 quadrants, improving clinical experience, improving patient experience, lowering costs and better outcomes. And what goes across all of those, we don't put a product or a solution in market unless it meets 3 key needs. It's got to be able to reduce costs. It's got to be able to improve or increase appropriate revenue capture, and somehow, some way, improve the quality of care through the eyes of the physicians and the patients. So bringing a combination of software and services in a systems integration way builds upon what they've already invested. It complements what physicians and patients are already doing while introducing, again, the change management principles. And the DeliverHealth approach to digital health is all about delivering for those stakeholders. So, when you think about the solutions that we offer, it's not surprising that when you look at it through the lens of clinical experience or patient experience, if you address those 2 and you can drive costs out, you're going to get better incomes because they're all sort of linked together. And our vision is to improve the healthcare shortcomings of cost, administrative burden. All too often, solutions meet maybe 1, maybe 2. We don't allow ourselves to do that. It's got to be nail cost, revenue, and quality.
And maybe a good next question, Michael. You talk about how all those things come together, and really it's about a combination of software and services, but the platform on which that's built. So talk to me a little bit about the DeliverHealth platform, which includes digital health, as you mentioned, coding, documentation solutions as well. How is it developed, and what does that really look like?
Yeah, so I would say our strategic direction was born on the foundation of a single hosted secure platform that's already installed in 2,200 facilities across the US, Canada, and Australia, and already has bidirectional data flows, but was limited to a single use case around documentation. So we recognize the massive undertaking that digital transformation is to our customers and their patients. And we invested to expand that capability and close that last mile of engagement between physicians and patients, and do so in what is known as an omnichannel synchronous way, like it's done in other industries, banking, travel. And we can do that in healthcare. We can enable a better patient experience that enables a better physician experience and vice versa. So we chose a digital-first approach with enabling tools like virtual agents, mobile, appless, and app-centric approach, where each can be interchangeable. That's kind of the digital side,
sure,
if you will, or the tech side of the equation. Then we took our history of services at scale and our awesome team of operators and leaders and wrapped around the tech with appropriate human in the loop, where a human is needed to address any of the weaknesses, breakdown, or challenges in the patient or physician experience. So connecting the digital engagement through whichever channel is the choice, with always needed a human in the loop, becomes this foundation for the tech-enabled services that we're built on. So, when you talk about documentation and how does that fit into the patient experience? Well, documentation quite literally is for clinical, legal, administrative, and financial reasons. Unfortunately, it's the lowest common denominator in healthcare, and that creates part of the burden. So we were born out of documentation and we're expert in it. But fundamentally, in every industry and every business, ultimately, words need to turn into numbers, right? Sure. And so you take a quote and the words that are in that quote and you somehow turn it into a dollar value. Well, the same is in healthcare. What care was rendered as it was documented needs to be codified ultimately for reimbursement, for research, for all kinds of different reasons. And that's what coding is. So, we saw a great need and opportunity to build upon and extend our foundation in documentation to start to simplify the opportunity of converting words to codes, which is a huge challenge. But we do that all in a single platform installed across those 2,200 facilities, again, reducing cost and improving quality. Because if you have bad documentation and you realize that, it's bad because it didn't reflect the care that was given. Yeah. So if you have poor documentation and you code inaccurately, then that could affect care. It's certainly going to affect reimbursement and compliance. So, all that, how does it connect to the patient? It connects to the patient because the patient has many different experiences. They have a clinical experience, they have an access experience, they have a communications experience, and they ultimately have a financial experience. Historically, often today, each are very, very separate and distinct and somewhat disconnected. So we aspire to simplify that and enable hospitals and health systems who are really, really patient and consumer focused to create a better omni-channel engagement experience with the options for patients and care teams to choose in the moment what's best for them, create trigger events that remind a patient of their appointment. So it's the digitalization of healthcare is evolving. We just try to look where there's complexity and simplify it.
Yeah, and I got a question for you. I'm going to ask you in a moment about some existing clients or partners you're working with in the digital health space. But before I get there, I wanted to touch on something you just mentioned, human in the loop, and the importance of people and ultimately process. Because a lot of what we're talking about, what KLAS is looking into, as we've mentioned, is a technology, but we all know that people and process are really important. Talk about innovation and process, innovation and people. What does that mean to you?
Let's just use a call center person where 50-year-old male calls in to get an appointment for what they need, and they go through the call tree. They have a long wait time. The reason there's not enough agents, there's not enough technology to triage. It wastes that patient's time, it wastes the agent's time. So we try to figure out right up front, are there digital channels that can resolve that simple patient scheduling question and never have to get to the human? But let's play that a little bit further. Let's say there's digitalization in there and, through a chatbot or through a text, they schedule their appointment. But with that appointment being scheduled, they get another text that gives them a form to fill out in advance, and they have a question on that form. Historically, they're going to either have to wait and fill that form out when they get there, or they stop filling out the form because they have a question. We can allow and put that human in the loop by having a live chat to answer that question, or a live agent if they just need to talk to somebody. So it's that many engagements can be purely digital. Very few have to be pure voice and human in the loop. It's really the mix in the middle.
That's awesome. So let's talk a little bit about any existing, again, clients or partners. You talked about some of the A+ rankings from KLAS prior to this report. Are there a couple clients you can think of that are worth highlighting in the context of digital health that you're working with today?
Sure. I'd love to name names, but given the listenership out there, I really, without the clients kind of on the line, it probably wouldn't be appropriate. But we can talk about, we serve the multiple segments, care settings, end user stakeholders, and there's multiple stakeholders in each of these various different segments, right? It's the physicians, the care teams, operations, administration, they're all involved in that patient experience. And quite honestly, they're all beneficiaries of the solutions. If it's easier for the patient to fill out a form, that entire benefit ripples through to the physician having it in advance in a readable form, the administrative staff not having to do it. So it really flows through. But, moreover, each of these stakeholders and the complexities that they run into depend on the care setting, whether it's inpatient or outpatient, acute, post-acute, and there's various different hospital types. And it may just be a group practice. So we have a range of customers from group practices, community hospitals, FQHCs, academic, clinically integrated networks, for-profit, not-for-profit. They all deliver healthcare, but they all have some level of unique needs in their environment. And that's where the platform and our ability to integrate and interface through things like HL7, Smart on Fire, or we have APIs or are these partners that are these point solutions we're pulling together, have SDKs, software development kits. And we put all that together because we've got to be prepared to meet the customers, again, at their state of readiness and with the investments they've already made. And so, I know you asked a little bit about what are some of the outcomes. It really boils down to 4 or 5 of them. Realizing the benefits of investments they've already made, cost reduction, hard dollar and cost avoidance, revenue improvements, time savings for physicians and patients. It manifests in higher patient satisfaction scores, greater loyalty. And again, just overall, that simplification really helped address some of the burnout that caregivers face today.
Sure. I really appreciate all of your thoughts and wisdom today, Michael. But as we wrap up for our listeners, what can we expect from DeliverHealth in the future?
I'd just say more of the same, because the sky's the limit. The only problem out there that doesn't have a solution is limited by creativity. And so our model is to find the right partners. Think of our solution as a systems integrator or systems integration, but complemented and supported by bringing needed and simple technology wrapped with services. So we solve a problem, then we move on to the next one. So the future is us sitting down with the customers in a very consultative manner, understanding their current situations, needs, figure out what's available or not, and then bring that back to them and address it at scale. I think you should expect more automation, greater levels of digital experiences, and again, a more seamless, simple, smooth process that allows integrations and eliminates point solutions that I think historically have not been addressed.
Yeah. Well, this is great. For any of our listeners that want to get in touch with you, Michael, what's the best way to reach out and connect?
Yeah, it's probably email, michael.clark@deliverhealth.com.
Excellent. And we'll include all that in the show notes as well. Again, thank you so much for your time, and everyone else for tuning in. Have a good day, and we will see you next time. Thanks again for tuning in. If you like what you heard, please share, rate, and review on Apple, Spotify, or your favorite podcasting platform. For more content about simplifying healthcare, visit deliverhealth.com/resources, where you'll find our blog, videos, and much more. We'll see you next time on Healthcare Simplified.